So it depends on the type of surgery. The sleeve surgery, we can see there's some staples. These staples here keep the stomach sealed, so the sleeve surgery removes a substantial portion of the stomach. The gastric band does not have staples but this ring around it, and the bypass has this staple here but also joined to the bowel here. So the risks, look, anything substantial risk, be it infection, leakage on the staple line, bleeding, might need a blood transfusion or return to theatre, blood clot, these sort of more significant complications obviously, I'd say are in the order of 1 to 2%. So it is uncommon, and there can be other things that can happen along the way. So reflux is mentioned with the sleeve gastrectomy. It's very uncommon for it to be a serious problem, but obviously sometimes it can be an annoying problem, and sometimes people need medication for it, for example. And anaesthetic risks, anyone undergoing an anaesthetic has a risk, although they're remote risks, but you can be allergic to a medication, you can have a blood clot as a result of surgery, like going on a plane. Another thing to talk about is risks of nutrition over time. So the recommendation is to take multivitamins, eat a well-balanced diet. Often people are already a bit malnourished before surgery is a reality. Sometimes the vitamin D may be low. It's not really often a big problem, people that are compliant with the multivitamins, for getting nutrition problems. It can be more common with the gastric bypass because 1.5 meters or so of bowel is not having food go through it. So iron deficiency can occur, which is already a common problem maybe amongst some of you. And down the track, the gastric bypass does have a small risk of an ulcer on the stomach or a bowel twist. That may risk maybe 5% at some stage in the future. That kind of risk doesn't really exist for the sleeve gastrectomy. And the gastric band, it's more about the tolerance usually of it, but sometimes the stomach can move on the band and it might need corrective surgery.